Hi, and welcome to Real Talk, Real Solutions. I am Teresa Giles. I'm the CEO of Hope and Help, and I am so glad you chose to join us in our episode 2. Now, this is our first episode that we're inviting a guest, so I'm very excited about it. And just to remind you, this is our first season. We're going to have 12 episodes in this season, so you don't want to miss any of it. All right, we're going to get started. First, I'm going to introduce our guest, and that is Dr. Michael Miniski. And he is a renowned doctor right here in our area. We're so fortunate to have him, who is an infectious disease doctor. So I'm going to let him tell you a little bit more about him when he comes on. But I just want you to sit back and relax because this is something you don't want to miss. All right. Dr. M, welcome, welcome, welcome. I'm so excited that you're here. Now, listen. Most people think HIV is over. They think it was a crisis back in the 80s and the 90s and that we've already dealt with it. Now, Florida tells a different story. And the thing about it is, while the nation has made some progress in our state, our home, we are consistently ranked in the top 3 in the nation. That means when they take that poll about infections and how they're spreading, Florida still comes up at top 3 for HIV transmission. Now, this isn't a problem of the past. This is something that we're dealing with today. It's the present epidemic beginning right now. Our cities, our neighbors, our family, our friends. This is why HIV Real Talk, Real Solutions is so important. We need to talk about it. And today, we're going to ask the hard questions. I'm going to ask some of those hard questions. Why Florida? And what are we doing about it? So, Dr. Miniski, I'm going to turn it over to you. I just want to ask you this. Tell us about that. Why is it happening?
Sure. Well, first, Teresa, thank you for having me on the podcast. These opportunities come around once in a long time, and I'm really happy that you invited me.
I'm so happy you're here.
And I thank you for bluntly calling the problem for what it is. It truly is a crisis. And why is it a crisis? Well, one of the reasons why is that we've chosen to stop talking about it with each other. And as a community, we're treating it as if it simply was in the past, but it's still a real and present danger. You said Florida is in the top 3 for HIV. So what does that mean? I could tell you what some of the data shows, and I could lay out some of the numbers for you.
Please do.
Yeah. If you look at the top rate of new diagnoses of HIV in our area, which is measured cases per 1,000 people who live here, right? Florida is consistently number 1 or number 2 in the nation. The only places in the country that are greater in new cases of HIV than us is Georgia and the District of Columbia. So naturally, we are consistently way above the national average in new cases. It's hard to say how many new cases there are because we're only getting cases that are reported from testing. And it's the tip of the iceberg. So there's probably a lot more of unreported cases going on. I don't say probably. There definitely is.
Absolutely.
So here we were making progress in reducing this years ago, but now that has stalled. And we're seeing tens of thousands of new infections every year. And what's distressing about it is, for example, the CDC, Centers for Disease Control, estimates that a significant proportion of everybody who's newly diagnosed had no idea that they had it. And everybody else out there who has HIV doesn't know it either unless they get tested.
So we're not just seeing new cases. We're actively transmitting. Whether we know it or not, we are actively transmitting more right here in Florida.
Precisely. We're a national hotspot. And if we look at it more locally at our metropolitan areas, the ones that are bigger than Central Florida are Tampa, St. Petersburg, and Miami. Those are only 2. We passed Jacksonville a while back in a number of cases. It's not just a Florida problem. It's an epidemic being supercharged by specific local hotspots. And we're one of those hotspots.
That leads to a core question. Why? What makes Florida such a hotspot for this virus? Why?
There's not one single answer to your question. It's a perfect storm of structural and social factors all coming together into a head to cause this. One of the key problems, let's talk about stigma. In 2025, which is last year, people are still more afraid of positive test results than they are of the virus itself. The virus untreated leads to AIDS, which is the final diagnosis and the thing that kills you. That stigma of fear and that stigma of labeling people in our communities, in our families, and sometimes even in the doctor's offices. This is what stops people from getting tested. It makes them reticent, scared, and fearful that other people will hear about it and they'll be labeled, and so they don't get tested. And getting tested is bad.
This stigma is real.
It is real, absolutely. The fear of being tested, and so choosing not to be tested, is the number one barrier to all of this. And that real world consequence is a problem. We have a lot of people here. For one thing, we're a global destination.
Yeah,
for
absolutely.
lots of people. Something over 70 million people come here to visit who don't live here. Our base population, we have huge gaps in a lot of important things, and that's part of that perfect storm. So you have stigma, now you have gaps in the medical system, gaps and deficiencies. And you would know these, and a lot of our listeners, I'm sure, have maybe suffered this with health insurance, coverage gaps, just hundreds of thousands of people now trapped in that gap. Critically, we have other systemic challenges that are in our education within our communities and in the public. And I don't necessarily mean schools. We are not giving young people a comprehensive, medically accurate information they need
Absolutely.
to protect themselves and to make decisions about these important medical issues.
Now, you talked a little bit about it, but I want to go back to Central Florida being that hotspot and the why. But specifically, we're seeing higher rates. Talk a little bit more about that. And I know, like you said, everyone comes to visit Florida, but talk a little bit more about the high rates.
I'll tell you some of the factors that go into making these high rates. For one, we're a large population. Our population is very diverse ethnically as well as socioeconomically. In fact, I don't know if you know it, but there's more than 2.9 million people who live in the Orlando metro area. And so there's
I'm sorry, did you say 2.9 million?
2.9 million in the metro area, not in the city itself, but in the metro area. If you combine all the small towns that make up what we call Orlando metro area, it's 2.9 million people who actually live here. And then you put on top of that a massive service and tourism industry. Many of these people work. Many are uninsured or underinsured because their jobs don't cover them as well as they could possibly hope. And the population is on average, too, young and socially active. I can just give you another statistic. The average age of the resident of the metropolitan area of Orlando is 38.9 years.
Very young.
Young, under 40 years old, where it's closer to 43 years old for the rest of the state.
Yeah.
And you might say that's not a big deal. No, but statistically that is a big deal because when you look at the big numbers, then you have more young people. Now, that doesn't mean young people are bad people and they do bad things. They're just more active and more socially engaged. And that leads to problems with fighting the virus because we still have outdated attitudes about sex and health.
Right. And if we're not talking about it, if we're not teaching about it, it keeps going on. You're right.
So not everything is based on any one single one of those statistics I told you, including tourism, because tourism doesn't spread this disease. It's everybody who lives here and everybody who comes here and everybody who engages in activities that could spread the virus of what the people are doing, but because of massive gaps in our healthcare and educational systems, and add stigma on that, and that's your perfect storm.
So now we've talked a little bit about the statistics. Let's look at the demographic areas. Is it just one particular set of people that it's impacting? Because some people feel, oh, it wouldn't impact me. What are the demographics? What is the data telling us about that?
If we look at how you define the demographics and what the most common individuals who have HIV, unfortunately, it's disproportionately Black and brown, and often follows patterns of lower socioeconomic situations, and that leads to less health care, that leads to less health education, and that, again, plays into the storm. So the other thing is, I could be even more direct. Black men who have sex with men, they carry the highest burden of everyone in our area for contracting HIV. And we're also seeing incredibly increasing rates in Black women. So they're even more disproportionately involved with the epidemic. A Black woman is exponentially more likely to get HIV in our area than a white woman of age.
I was at the mayor's office a few weeks ago, and the data came out that African American women were transmitting 23% higher. And this is just data that just came out. Right. So you're absolutely right. Now, I'm going to pause there because everything you just said, there's a vital point, and I don't want the audience to miss this. Is it about different behaviors?
No, that is a common belief, which is a fallacy. Let me be absolutely clear about it. It's not about behavior or what one's doing. It's not because you're a bad person. Right. It's about barriers to care, barriers to testing, barriers to understanding and education. That's what it's about, barriers. It's about who gets non-judgmental health care.
Exactly.
Because you give judgmental health care, meaning I label you, that plays into the stigma, and that's what causes people not to want care. It's about who is offered preventative care for HIV. People who aren't infected can be offered preventative care, like PrEP, which stands for pre-exposure to HIV prophylaxis, which means prevention of the infection. If you take the medicine, it prevents it. And we'll talk about that hopefully a little later more. But there are also big-time economic factors, homelessness and instabilities, and transportation issues. Even though you offer health care to people that is not just adequate, they can't get there, or they can't afford to get there, and they can't certainly walk there. So that is another major problem. And it all makes it very difficult for someone to get care. That's a major issue.
And one of the things I've found about PrEP, because even learning about it as an adult, a lot of times we have this stigma that we don't need to know about PrEP. I don't need to understand PrEP because that happens to someone else. But I think everyone needs to understand PrEP. You are a teenager all the way until we leave this great earth. But it is very important. And if our listeners don't know about PrEP, please come to Hope and Help, because PrEP is an important educational material that you should be able to share with your family and friends. So I'm glad you brought PrEP up, Dr. M. Now, one of the things we have to stop asking is why certain people are getting HIV, and start asking why our systems are so profoundly failing to protect them. It's the same thing that you just said, prevent being able to access care, transportation, the education. So we have to stop asking that and say, how did we get to this point? What can we do? So I want to move on to this, because it feels a little bit overwhelming. And I know if you're listening to, you might be thinking this is overwhelming. It sounds like it's an impossible problem. But there's a plan. We always have a plan. Tell us about Ending HIV Epidemic Initiative. And is it working?
Well, unless we adopt it, and like Hope and Help has adopted it, other healthcare entities that take care of HIV infected people, it's not going to work, obviously. Right. So there's a four-pronged approach that works best. Since the science is here, we have good news. So we have to diagnose. We have ways to do that. Then you got to be treated if you're positive.
Because it's not a death sentence anymore.
Right.
So we don't have to be afraid of that diagnosis.
Right.
Okay. All right.
Which you should be afraid of. If you have it and you don't get treated, it becomes death sentence.
Right.
And that's totally preventable. So that brings us to number 3. So we have diagnose, treat, prevention. Mm-hmm. And the last is to respond to what you're doing. So let's go over each one of those, okay? Diagnosis. Diagnosis needs to be more of a routine thing for HIV with easy accessibility and the removal of the stigma we talked about. That's what's important. It should be as simple as checking your vital signs, like your blood pressure at the doctor's office. As
a female, I go for my annual checkup. It's not part of the panel. I have to ask for that test.
Right. A lot of hospitals and doctors' offices, a part of their panel is hepatitis C testing, which is admirable. But why not HIV? And that's, I think, where the stigma issue comes in.
Okay, right.
So let's say you get tested and you find out you're negative, or you find out you're infected with HIV. Undetectable levels of HIV in your blood, meaning we can't measure it by the tests we do, is you can't transmit it. And so we call it undetectable equals untransmissible or equals. So I always say, if you go to get tested and take care of yourself like you're supposed to, then you are you, and you're an HIV infected person. You're on the appropriate medicines. you become undetectable in your blood with the virus, you cannot sexually transmit the virus to a partner. The answers are just zero.
So I can safely have a very active, productive life with a partner as long as I'm doing what I'm supposed to do with the medication and not transmit to my partner.
Treatment is prevention as well. So that's really important. Then the prevent part, it jumps right to the next part of prevention. The next part is we have some miraculous stuff called PrEP, the pre-exposure prophylaxis, which we talked about just a little while ago.
Yeah.
It's a pill or sometimes an injection, and it's your choice or a choice between you and your doctor, which is best for you. When it's taken as prescribed, over 99% effective at preventing HIV. If you have a social situation where you might exchange bodily fluids and possibly infect someone. So if you take the medication beforehand, that is the prevention. And it's a miracle of modern medicine that this was developed.
Right.
Think about it. It's woefully underprescribed, especially in communities that need it most. Now, think about this. Can you think of another disease where you could take a pill and then you can go do something and it doesn't injure you? Very few things that fall in that category. There are some, but not like this. This is pretty amazing stuff. And preventing an illness, AIDS, that is so devastating and it's so easy to prevent. And unfortunately, like I said, woefully underprescribed, which is a sad thing.
Do you think it's just stigma or people don't know about PrEP? Or is it we have to do a better job of advertising, educating? How can we become more in our community to let them know about PrEP?
I think there's several approaches. One is we have to educate people about PrEP and let them know that it exists out there so they can, like they see an ad on television for a certain medication the drug company is pushing. We should push PrEP and say, look, here, this is available. Ask your doctor about it.
Yes.
And don't be afraid to ask. And don't be afraid that your doctor is going to think, oh my God, this person's having all kinds of sex. That's nonsense. It's your life and
Exactly.
This prevention is available for you, and a doctor is following Hippocratic oath, and he or she is going to help you make that happen. I think that the other issue is physicians don't routinely ask about sexual history.
Yeah.
And that, I think, needs to happen in our high HIV areas and basically everywhere in medicine. That should be asked, and then PrEP offered and give them the pluses and minuses of PrEP. Sometimes the medication makes your stomach upset and things like that. But you need to talk with your physician or your healthcare person who's going to prescribe it.
So what you're telling me is that the science is there. They've given us that solution. It's not in the failure in labs or the treatment. It is there, but it's the access and the delivery.
That's what it's turned into now. In the late 90s, the science was a problem. We didn't have enough.
Right.
And the virus become resistant to medications real quick, and then we didn't have good choices. Now we have tons of choices, tons of ways around it. And so that's a major difference. We're getting closer to a potential cure. We're not quite there yet. It might take another decade, but I think we're going to eventually get there.
Yeah. I like
The last thing I want to tell people, the last thing you have to do besides the three we just talked about is to respond. Now, what does respond mean? If the science is solved, as you said, and the failure isn't in the lab or the treatments, as you said, it's access and delivery, and we have to talk this up a lot. And our politicians need to help us out in this problem, or else we're not going to go anywhere.
Yeah. I enjoy the conversations. I love the talk because it's real talk and time gets away from us. But Dr. M, for every single person right now that is listening to this podcast or is watching this podcast, they could be at work, they could be in their car, they could be at lunch. What's the one thing that they need to do after hearing our podcast today?
2 words. Get tested.
Get tested.
3 more words. Know your status.
I like know your status. Okay.
This is powerful information that you can own personally. It's not a moral judgment on you. It's a simple, vital healthcare data point in your life. If you're negative, then ask your doctor about PrEP, as we said. If you're positive, you must get into care immediately so that you can live a long, healthy life and stop transmission in your tracks. The long-term outcome for someone with HIV who's on appropriate medications is almost better than someone who has diabetes who's on diabetes drugs. It's amazing that we've taken death sentence to a life of prosperity and happiness.
And I know for us that are negative and they've already been tested, their work isn't done. It doesn't mean we can just say, yep, I'm done. I don't have to do anything I have to worry about. What should we be doing?
Well, you should think of other people, people who didn't get tested, and also people who were tested and who were tested positive. So your job now becomes that of an advocate. Everybody who has gotten tested or who has found that they're positive, regardless of whether or not they were tested negative, you can fight the stigma. You could do it every day. You could listen for it. When you hear a joke or a myth about HIV, just shut it down, but not in a nasty way, but explain to people this is not appropriate. If positive, go to your doctor who knows about HIV and make sure that your doctor takes care of you with the right drugs and you'll live a great life. We have to ask our local politicians, I mentioned them once before, what are they doing to fund initiatives? Funding EHE initiatives will prevent a lot of problems and save tons of money.
Absolutely.
So the silence of people is what's creating all these new diagnoses, lack of treatment and lack of access to care. We got to get loud. We got to tell people that this is an important problem, or we're putting our head in the sand and denying.
I love the conversation today, and it is such an important thing that we continue to talk about. And so everyone that's listening to this podcast, I want you to continue conversation. Write in, give us some feedback. You can always write in and ask questions for Dr. M, and I would definitely get it to him. But this, a very powerful and urgent message, and it's right on time for us. And we're going to continue to talk about it as you continue to join us on Real Talk or Real Solutions. Dr. M, thank you. Thank you so very much for being here and just sharing your knowledge. And I'm sure we're going to be asking you to join us again on many other episodes because this is the information that we need in our community. So thank you. Thank you very much.
I do appreciate the opportunity to bring it forward to people. Thank you.
All right. So make sure you stay tuned to the next episode. And if you need any more, remember, it's Real Talk, Real Solutions. And make sure you do not close this episode without saying, I want to know more about PrEP and I need that information. Thank you. Thank you very much.